My name is Dr. Lama and the topic today is Angor pectoris. The Angor pectoris is angina pectoris is chest pain due to ischemia of the heart muscles, generally due to obstruction of the span of the coronary arteries.
Discomfort in the chest is one of the most common symptoms for which people need medical help. Angina, known as angina pectoris, is one of the most important conditions which causes mild to severe chest pain. Angina is a disease of the coronary arteries, affecting millions of people worldwide. Angina
The main cause of angina pectoris is coronary artery disease due to atherosclerosis of the artery feeding the heart.
Cause of angina pectoris. Atherosclerosis derives its name from the Greek words athero, meaning gruel or porridge, and sclerosis, meaning hardness. It is the hardening of the arterial wall and the narrowing of the arterial lumen due to the slow buildup of lipid-rich plaque on the inside walls of the arteries. Plaque is formed by the buildup of fat, cholesterol, calcium, and other substances circulating in the blood. Plaques are of two types.
Application in medicine. There is a weak relationship between severity of pain and the rate of physician deprivation in the heart muscle. In some cases, angina can be extremely serious and has been known to cause death.
It causes disability and economic loss, and in most cases impairs a person's quality of life. It also increases risk of fatal myocardial infarction or heart attack and death. The coronary arteries originate from the aorta and supply blood to the heart muscle. The word coronary is derived from the Latin word meaning crown, as the three main coronary vessels appear like a... These are stable angina, unstable angina, and variant angina. In stable angina, the chest pain can follow a regular pattern in terms of frequency, intensity, and duration, and is fairly predictable, normally occurring after physical and mental exertion. The patient may be aware or unaware of his exertion limitation. Stable angina is caused by a fixed blockage in the coronary artery, resulting in reduced blood supply to the heart.
Angina results when there is an imbalance between the heart oxygen demand and supply. This imbalance can result from an increase in demand without a proportional increase in supply due to obstruction or atherosclerosis of the coronary arteries.
Is the supply and is relieved by rest or medication. Unstable angina, as the name suggests, does not follow a pattern and is not predictable. Unstable angina can also be a manifestation of the latter stages of stable angina, where unlike stable angina, it can occur without physical exertion and is not relieved by rest or medication. Unstable angina frequently occurs at rest and is a more serious condition than stable angina.
Some causes worsen angina attacks, sudden onset angina at rest, and angina lasting more than 15 minutes are symptoms of unstable angina.
There are different types of chest pain, such as that caused by indigestion and muscular pain. However, anginal pain is the chest pain or discomfort that occurs when heart muscles are starved of oxygenated blood. Angina derives its name from the Latin word angora, meaning tight chest. Angina, caused due to blockage of the coronary arteries, can be classified.
The risk factors are age, more than 15 years for men, more than 65 For women, cigarette smoking, diabetes mellitus, dyslipidemia, family history of premature cardiovascular disease, hypertension, kidney disease, obesity, etc.
Started, quit smoking and avoid secondhand smoke. Maintain a healthy body weight, which means having a BMI between 18.5 and 24.9. You can check your BMI easily with an online BMI calculator. Get plenty of exercise. In general, aim for at least 30 minutes a day, 5 days a week. But check with your doctor first to make sure exercise is appropriate for you. This is especially important if you already have angina. If you drink alcohol, limit yourself to no more than 1 drink per day for women and no more than 2 drinks per day for men. Also, get checked and treated